Is that okay now?
Yes, madam.
Yeah.
Just a while, madam. We will start.
Yes, yes.
Shall I start, madam?
Yes, ma'am, you can start.
Okay, ma'am. Om Shri Dhanvantaraye Namaha. Om Shri Guru Basavalingaya Namaha. A very good morning to one and all, and a warm welcome to all of you to KumarabBharana 2020, a national webinar series on KumarabBharana, organized by Department of KumarabBharana, SVM AMC, Ilkal. So today we have a esteemed speaker, Dr. Champa Pant ma'am with us. So let me have a privilege of introducing a madam to you all. So Dr. Champa Pant madam completed her BAMS from BK Ayurvedic College, Jhansi, University in the year 1995, and completed her MD from Ayurvedic and Unani Tibia College and Hospital, New Delhi, Delhi University. And madam also completed yoga instructor's course from SVAS Yoga University, Bangalore. And madam worked as a resident medical officer in BK Government Ayurvedic College and Hospital, Jhansi, and as a medical officer at Christian Mission Hospital, Jhansi. And madam worked in the field of obstetric and neonatal care in that hospital. And madam was also scholar of Rashtriya Ayurveda Vidyapeeth under Dr. Premavati Tiwari madam at Mata Anandamayi Hospital, Varanasi. And madam is having 11 years of teaching experience in the Department of KumarabBharana and presently working as a professor in the Department of KumarabBharana at Sushruta Ayurveda Medical College and Hospital, Bengaluru. And madam is also research dean at the same college. And madam has secured first rank in BK Government Ayurvedic College, Jhansi, and 8th rank for Kanpur University in the year 1995. Madam is also first rank holder in All India entrance exam for Rashtriya Ayurveda Vidyapeeth, New Delhi. And madam also secured second rank in All India entrance exam for MD for Delhi University in 2001. And madam also secured 7th rank in All India entrance exam for MD course for National Institute of Ayurveda, Jaipur at the year 2001. And madam is having many publications to her credit. Madam has published around 5 research papers in peer-reviewed journals. And madam also attended many national and international seminars. And madam organized National Conference on Education, Educational Administration and Excellence in Indian System of Medicine at IISc Bangalore on Jan 2019, and organized a workshop on empowering employability through entrepreneurship Spurti on August 2018, held at SVAS Bangalore. And madam was also organizer of 23rd International Conference on Frontiers in Yoga Research and its Application in Jan 2020 at SVAS Bangalore. We are happy to have you with us, madam. So just before we begin, there are a few instructions to the participants. Please display your full name, mute your audio while joining the session. If any queries, the queries can be dropped in the chat box, which will be discussed at the end of the session. And in case of any disruption, please wait patiently until the resume of network connectivity. Thank you and welcome you all. Over to you, madam. You can start your presentation.
Thank you, ma'am, for such a nice introduction to me. I thank, first of all, God Almighty, my gurus, and I would like to thank management and principal of SVM Ayurvedic Medical College, Ilkal, And I would like to thank Department of KumarabBharana faculty, and especially Dr. Vishwaradhya, who approached me for this occasion, and he gave me opportunity to speak to all the students and whoever is there in this seminar. I thank you all. And last but not least, I would like to thank all the students who are attending this seminar, because I know that you have already finished your syllabus and you already know everything in KumarabBharana, and it is just a repetition for all of you. So you have to bear with me for 1 more hour, and I would try to impart something which I know, and you might be already knowing that, but it's like a revision for all of you. So I thank you all of the students also. So I would I would just stick to Ayurvedic part of malnourishment. I will not go too much into modern concepts of malnourishment, because I feel that in Ayurveda so much is told about malnourishment, because that if we take even 2 3 days we cannot finish it. There is so much about nourishment in Ayurveda. So I will just stick to Ayurvedic views on malnourishment and nourishment, as well as nourishment. And also, I would try to explain how the Chikitsa Sutras, which are given for malnutritional disorders in Ayurveda, we can use them clinically, how we can make use of them in modern situation. And also at the end of this PPT presentation, I feel that you would be able to connect to Ayurvedic concepts to clinical presentation of malnourishment. That's what my aim is. So let's start with this presentation. So all of you are in third year, and all the classes are over, all the practical classes are over. So I believe that most of you must have seen a normal delivery. Okay. So the moment head is born in a normal delivery, have you ever noticed the features of the newborn baby's face? There is complete plethora there. It is totally congested. The eyebrows are constricted and face is engorged, and he is just trying to struggle. Struggle for what? His first scream. He wants just to take out that loud scream, that loud cry, which will enable to open up his pranavahi srutasa, and which will enable him to take his individual breath for the first time. You might have noticed that. And till now, when he was in mother's womb, everything was reaching him nicely through placenta and umbilical cord. But now that connection has been cut off. So his whole aim is there to get that first breath so that he would live. This quest to live, this quest to prana is, that's what Charaka says as praneshana. Okay. So this praneshana is there in our, the moment we are born. Even before that, this praneshana is there, eternal quest to live. And then you might have also noticed that when you are cleaning the baby or you are touching his face, then immediately he would turn his face in your direction and in the direction of the hand which is touching, and he would start seeking something. What he's seeking? He's seeking for something which will feed him for next few months, which will sustain his prana. That is mother's milk. You must be aware of rooting reflex. That's how you elicit it. You touch the side of the cheek and child will turn his face and try to suckle the finger. Or the moment you put the child to mother's breast, he would just turn his face and start suckling. Who taught him that? Nobody taught him that. How is that quest? How is that instinct there in his in him? So this is all praneshana, and this praneshana enables him to seek out whatever will sustain his prana, and that is first ahara. So ahara or stanya or annapana, whatever you call it, whatever will give him nutrition for whole his life till he is alive, that is very important. You might have noticed that our acharyas, they have written chapter upon chapter on this, shlokas upon shlokas. For example, take Charaka Samhita. After four initial chapters are over, immediately Charaka starts Swasthya Chatushka. First chapter is Matra Shati Adhyay, Tasya Shati Adhyay. Elaborate description, okay, about ahara, anna, pana, how to do, what not to do. And then again in Yojana Chatushka, Yajya Purushi Adhyay, and all those four chapters. Then again Annapan Chatushka, four chapters. Okay, so effectively he is talking a lot about nutrition. He's trying to teach us not only in Charak Samhita, Sushruta Samhita, Vagbhat Samhita. Every Ayurvedic book is full with so much about nutrition, because our acharyas knew that if we want to sustain our prana, nutrition is very much important. Okay, ahara is annapana is very much important. So that's why you will be seeing so much about ahara in your samhitas. Now there is a question whether only ahara or annapana, is that nutrition? If you look carefully, that is only 1/3 of nutrition. In Ayurveda, nutrition is you can say a result of three main things, that is ahara, as well as agni, as well as srotasa. Okay, so once a child or a person, he take ahara, he takes it down his gala, it reaches inside the stomach, or it reaches inside the amashaya, starts agni starts working upon that, and agni enables it to get digested. Agni has many associates also. Ahar pariramkara bhavas are there, kleda kapha is there, samanavayu is there, jatragni, to help jatragni. Further other agnis are there, bhutagni and dhatwagnis are there. So agni along with its associates will enable this ahara suitable for our body. Okay, so agni is equally important in nutrition. Then comes srotasa. Third part is srotasa. Now suppose ahara is there, agni has digested it, body is trying to absorb it, then it has to reach each and every cell of the body, each and every dhatu in the body to nourish. It's work of adi ahar rasa dhatu to nourish all the dhatus. What is helping in that? Srotasas. These are the channels which will carry this nutrition to each and every cell, particle of the body. But if there is srotaso avrodha, if srotasas are not fine, if they are blocked, what will happen? In spite of good ahara, proper agni, child will be malnourished or undernourished. So these three are basic pillars of nutrition in Ayurveda, which is ahara, agni, and srotasa. I would emphasize equally upon these three, because you will see that when you must have noticed by now that whenever you are reading the etiopathogenesis of nutritional disorders in Ayurveda, then you will see either problem is there with ahara, or there is problem with agni, or there is problem with srotasa. Okay, or there might be a collective problem involving all these three of things. Okay, so that's how our treatment is also planned according to the problem, where the problem is present. Okay, so what are the function of ahara? Since your first year, you have read a lot about ahara, anna, what all it does to our body. I will just focus upon what it causes in children. First thing, we have already discussed that it sustains prana in our body. You might have noticed Charaka has told prana prana bhratam annam loko bhidhavati. Okay, and annapanam tu praninam, prani sangyakanam, pranamuchyate. The prana itself is anna. So its biggest function is to keep us alive. Okay, and then you see our life starts from a single cellular stage, a zygote stage, and then in an adult, there are zillions of cells present. So what caused this enormous amount of growth? What caused that? Only ahara, only rasadhatu, which is result of ahara. Okay, and you know that vriddhi happens only in children. Once we attain our adult stage, scope for vriddhi is not much, only sustenance is required. So in children, ahara's main function is to enable the child to grow from a single cellular stage during pregnancy to an adult stage. Okay, that is very important. You might have noticed where Charaka describes Sharira Vriddhikara Bhava, he says that Anna is not only Sharira Vriddhikara Bhava, but it is the only Sharira Vriddhikara Bhava, he says. Okay, so Anapanam to ekamev sharira vriddhikara bhava. Only one. It is so important. Of course, there are other things which are responsible for sharira vriddhi. So bhava se bhi vriddhi hoti hai. So bhava itself is responsible for vriddhi, but annapana is very important. It is important for forming all doshas, dhatu, mala, everything, khamala, whatever is in our body is formed by the food we are taking. Okay, so how this malnutrition is occurring, Ayurveda has told so much about nutrition to us. Why we are still, since time of Samhita Kala, we are seeing malnutritional disorders, isn't it? Charaka has described malnutritional disorders, Sushruta, Vagbhata, Kashyapa, they all have described, and same malnutritional disorders we are seeing today in 21st century also, when man is sending people to moon, when man is sending land rovers to Mars, we have become so much developed. We are doing what not. Look at this time. I am in Bangalore and I'm talking to all of you. Okay, you can see me on the screen. I can talk to you, I can present, I can speak, and you can all listen. So we have come so far. But at the ground level, if you go out, you go to a construction site, you will see children sitting there with golden hair, with flag sign, with bloated tummies. Nothing has changed there. We are still there. We are still from Charaka's time to today's time. We are still there. Malnutritional disorders are still there. Then why it is happening? Because somewhere we are not maintaining the balance. Balance in what? Balance between supply and demand of the nutrition to our body. Okay, you look at overnutrition, there is too much supply. Okay, or we are not spending enough of what all food we are eating. If you look at undernutrition, there might be less supply and we demand more. We might be working a lot, we might be studying a lot, we might be falling sick again and again, increasing our demand, and our food is not able to maintain that demand. So it is nothing. There is just one root cause of malnourishment, that is imbalance between supply and demand. Okay, so if you look at the gamut of malnutritional disorders in Ayurveda, what is the range of malnutritional disorders in Ayurveda, you will notice that acharyas have not left anything. Okay, there is a whole range, right from overnutrition to undernutrition. Okay, so in overnutrition comes all santarpanajanya vyadhis. Among them, most prominent is stholia. Okay, I would agree that stholia has not been described as a malnutritional disorder among small children. you will not notice it. Okay, but Charaka has in Ashtonindit Adhyay 21st chapter of Charak Samhita, he has elaborately described dyspholia and its treatment and how it happens, what it causes. So same thing applies with children also. You might have noticed that overnutrition is becoming an equally bad, and rather I would say it is becoming worse than undernutrition these days. And actually, WHO has found that death because of overnutrition is much more than deaths because of undernutrition. Okay, so what all Charaka has told about Stholia, we will apply same rules. We, in fact, in clinical practice, we apply same rules to treat obesity in children. Okay, among undernutrition, malnutritional disorders, undernutrition, you will see that there are several categories described in Ayurvedic text. First one is all type of apatarpan janya vyadhis will be there. Okay, among them, karsha is very important. It is very common. I would say that most common problem found among children, malnutritional problem found among children. Okay, karsha is. Then acharyas were not very ignorant. They were not ignorant of intrauterine malnourishment. You might have noticed that they have described so many conditions: nagodara, lean garbha, upavishtaka, upashushka, garbhashosha. So many problems are there where the fetus is not gaining weight, he is not growing, and ultimately either there is severe problems or there is death of fetus. There is fetal death also. Okay, so these disorders are nothing but fetal malnutritional disorders. They have been described by acharyas. Okay, then there are other conditions which are specifically found in children. These are balashosha. There are mainly three malnutritional disorders which are elaborately along with treatment they are described. Specifically they are present in children. Was first among them is balashosha, other is parigarbhika, and third one is Fakkaroga. I'm sure you all are very much aware and you already know everything about these three diseases. And then another thing is, as a part of other diseases, if you look at Andhaputana, Andhaputana is a graha vyadhi, okay? There is no dosha or dushya or no samprapti has been described for it. But when Andhaputana has been described, you will see that there is description of loose motions, vomiting that is happening in the child, and ultimately there is shosh in the body, and child is losing weight, and he is having drishtisad. Drishtisad indicates vision loss. Okay, there is impaired vision in. He is having Vavarnya. Vavarnya might be there in hair. Vavarnya might be there in the skin. Okay, his skin is changing colors, and also there are these infective disorders such as pothaki. They are happening to this child. So this Andhaputana is nothing but it is a malnutritional disorder which is mainly basically affecting the vitamin A supply to the child. Okay. Similarly, Shushkarevati, Jayante Shushkarevatya Kramat Sarvanga Sanshayah. So there is gradual emaciation. Okay, that there also you will see the signs of wasting are there. Similarly, Revati Graha, Shosh is a prominent feature of Revati Graha. Okay, so here and there Sandanshi Jadharani, there you will see that it is just like similar description like Parigarbhika, where mother is becoming pregnant and lactating mother whose child is breastfeeding, she is becoming pregnant again, and ultimately what is happening, this Sandanshi Jadharani is killing the previous child who was breastfeeding. So these scattered description of malnutritional disorders are everywhere. Okay, so if you read carefully, you will find so many malnutritional disorders. So we will start with fetal malnutritional disorders. Okay, So because I believe that well begun is half done. That is very important in our life. So if there is a fetus who is malnourished, then what will happen? That child, his birth weight would be less. After his birth, he might not be able to catch up the growth at all, and he might remain malnourished. So for to grow a healthy baby, to grow a well-nourished child, it is very important that his nutrition is taken care right from his conception. Rather, I would say that Ayurveda takes care fetal nutrition right before the conception. अगर आप लोग चरक, when you study charaka, sorry, I in between I jump to Hindi because that happens naturally to me. I'm sorry about that. So if you look at Charaka, you will see that he has described just before the Putra Kameshti Yagya, or just before the parents are trying to conceive, he has described Ahar Vyavastha both for father as well as for mother. Okay. And after that, he has described Ahar Vyavastha for Garbhini also. And till the end of pregnancy, till the delivery occurs, complete nutrition of the Garbhini has been ensured. Okay, so how this nutrition of the Garbha is happening? Rasajas Chayang Garbha, that's what is told. So this Garbha is created by Rasa, that is one of the Garbhakara bhavas. Okay, at every point, whether it is a single-celled stage or a full-grown fetus, 9-month-old fetus, all the time, rasa is enabling the fetus to remain alive. Abhinivritti, abhivriddhi, prananubandha, tripti, pushti, utsah. Everything depends upon the rasa. And not only rasa is an individual Garbhaj Bhava, it is responsible for the health of two other Garbhaj Bhavas also, Matraj and Pitraj, isn't it? Matra Bij and Pitra Bij, their health depends upon the nutrition of Mata and Pita. That is very important. You will see clear-cut indications by Charaka that if there is dosha prakopak ahara vihara pana, ahara sevana by mother and father, then the bija would be dushta. There would be bija dushti. Okay, so this rasa is responsible for fetal portion or garbha portion during whole pregnancy. If you remember, Charaka has told, everybody has told that whatever rasa is created in mother's body, whatever rasa is forming, it has three functions. It helps pushti of the Garbhini Sharir. It is sustaining the nutritional demands of the pregnant mother. It is helping in the formation of the stanya, and also it is responsible for the Garbhavriddhi. Now, very much important, if a mother is malnourished, then there would be obviously that malnourished will be carried forward for the newborn baby also, because the stanya formation will not be there properly. Okay, so these three parts are, these three basic works are being done by rasa. Okay, so how this rasa is helping in fetus to grow and to remain alive? Fetus has different shapes. Fetus is initially a single-celled animal. It is an embryo. It is a unicellular being, and later on it becomes khetbhuta. It is semi-solid, and then it becomes ghana in second month, and then panchpindika, and then it becomes all anga pratyangas are they are, arise at a time, and it becomes fully grown. So at every level, rasa is helping. Okay, if you look here carefully, मात्रादीनां खलु गर्भकराणां भावानां संपदस् तथा वृत्तस्य शौष्ठवान् मातृतश्चैवोपस्नेहोप upasneha and upasneha, upasveda of the uterus, which is helping in the initial stages of the pregnancy for the nutrition of the garbha. Okay, and later on, besides this upasneha and upasveda, what happens? Nabhyam yasya nadi prasakta, through to the nabhi of the garbha, there is nabhi nadi. This nabhi nadi is attached to apara or placenta. Apara is attached to matra hridaya, and matra hridaya is sending rasa in the apara, and these siras which are present in apara, they are oozing the rasa, and that rasa is resulting into garbha poshana. Okay, how nicely and how scientifically it has been told. Now you see there are 3 stages of garbha. Khetabhuta garbha, where there is no form, it is formless, it is semi-solid or liquid form. So in this, Charaka knew that at this stage, there is no apara, no nabhinadi. And you know that is true. You know that in the initial stages of the pregnancy, when there is no apara, no placenta, no nabhinadi, at that time what happens? Uterine glands, which had collected lots of lipids, which has collected glycogen, they start secreting the uterine milk, which is white in color. That uterine milk is responsible for the nutrition of the garbha. Later on, once the nabhinadi and apara formation has occurred, then they take care of garbha nutrition. Okay. So what happens? Why will a fetus become malnourished? It is very important. It all depends upon the environment and the ahara vihara of the mata, pregnant mother, what she is doing during the pregnancy. Okay. So first thing is, if you look at the causes of these nagodar, upshushka or leena garbha, first thing is there, pramitahara or upavasa. Pramitahar, very less food, or upavasa. If Garbhini is doing upavasa, she is not eating properly, then obviously rasa formation would not be enough. Okay, enough rasa would not be formed. And again, I would remind you, this rasa has to divide into 3 parts: for her nutrition, for her baby's nutrition, and also for formation of stanya. So already rasa is very less. So obviously the fetal growth will be impaired. Then vatal ahara vihara. At no point during pregnancy and even after birth, a garbhini or a sutika should be exposed to vatal ahara vihara. Okay, because vata has this shoshana tendency. It will result into shoshana of rasa. Okay, so if garbhini is indulging into vatal ahar vihara, then obviously there would be rasa shosha resulting into malnourishment in the fetus. Okay, sneha dvesha. If you will see, if you look at the Garbhini Paricharya, you will see Ghrata, Navnita, Kshira, Ghrata Siddhadi, Kshira, all Sneha Yukta Ahara Vihara has to be given to Garbhini. Rasa is Snigdha, its property is Snigdha. So Sneha would be, it would be supplying Snigdhata to Rasa Dhatu. Okay, so if Garbhini is sneha dveshi, if she's eating lots of dry things, if she's not taking enough sneha, then at one hand there would be loss of rasa. Other thing is there would be vitiation of vata. Okay, then comes Varjya Sevana. You will see there is a whole chapter on Garbholpa Ghatakar Bhavas. Do this, don't do this. If you do this, this will happen. If you don't do this, this will happen. So you carefully look at them. You will see there are so many do's and don'ts for Garbhini Mata, especially about food. If Garbhini is indulging in Katurasa Ahara Vihara, the fetus will be Durbala. If she is indulging into Tikta Ahara Vihara, Garbha will be Shoshita. He would lose weight. He would become emaciated. Okay. If Garbhini is lying Uttana means she is lying in supine position. So what will happen? Charaka has told that the Garbha Nabhi Nadi will encircle the Kantha of Garbha, and there would be no nutrition to Garbha. So you can correlate it, you can relate it. You have seen that in practical life, we tell pregnant ladies that please don't lie down on your back. What will happen? the gravid uterus is pressing the abdominal part of aorta, and then there would be less blood supply to placenta. So we always tell pregnant mothers, you either lie down, left lateral or right lateral situation. You don't lie uttana or don't lie on your back. Charaka has explained this in different way. Both ways, it is resulting into problem in the nutrition of the child. Okay. Then last one is yoni raktasrava. You know that if Garbhini is indulging into Ushna, Tikshna Ahara Vihara, or anything which is resulting into Yoni Raktasrava, that will obviously cause the malnourishment in fetus, because first Rakta loss is there. It will cause Pratilomakshaya of Rasa. It will cause Anulomakshaya of other dhatus. So child will be totally emaciated, and in severe conditions there might be garbhapata also, there might be fetal death also. Okay, so this is the nutshell of the causes of fetal malnourishment. Okay, now we will quickly discuss about what all fetal malnutritional disorders are described in different Ayurvedic texts. Okay, Vatabhipanna Garbha has been described. Okay, Vatabhipanna eva Garbha sushyati. So there is shosha in there. Okay, and similarly, Charaka has told ahara mapnoti yadana Garbha. If the garbha is not getting ahara and mother is indulging into too much vatal ahara vihara, then what happens? Because of the vata prakopa, there is garbhanadi skosha, and that results into vatabhipanna garbha or garbha shosha. Okay, it is basically because of vata visheshan. And then there is Upashushka Roga described. I will not describe them in detail. I know you all have already studied them, not only in KumarabBharana, but in Prasuti Tantra also. I will just briefly discuss them. So Upashushka has been described. Upashushka is because of Varja Sevana. If the Raktasrava is happening from Yoni, what will happen? There would be Vata Pradhan Tridosha Prakopa would happen. And again, Garbha Rasvahi Nadi Pidan and and Rasa supply to the Garbha would be impaired, resulting into Upashushka. Okay. Nagodara has been described. It is again Vatal Ahara Vihara and Upvasa. If Garbhini is fasting or eating something which will vitiate Vata, then Garbha stops growing. Okay, and there is Garbha Shosha and sometimes Aspandana. Aspandana is denoting that fetal death has happened. Manda Spandana is telling that Garbha is still alive. Okay, so there is a very severe complication of these malnutritional disorders, that lady might lose her fetus. There might be fetal death. Okay, Upavishtaka has been described. Upavishtaka is nothing but here because of Ushna and Tikshna Ahara, Yoni Srava is happening, and because of Yoni Srava, Rakta loss is happening, and Garbha Vriddhi will not happen because Rasa is not reaching to Garbha, and there would be Upavishtaka. So in nutshell, these symptoms, these different problems have been described, which are fetal malnutritional disorders. Okay, we will discuss their treatment, how to deal with them in detail later on. Now, malnutritional disorders in children. Okay, so if you look at, already I have told that from the time of Charaka, nothing has changed. Same disorders which Charaka, Sushruta, Kashyapa has described earlier, we see all of them very commonly. We feel that our country has become very affluent, we have become very much developed, and we have so much money, but in fact our children, every third malnourished child is Indian all over the world. This is a national shame for us actually. Every third malnourished child is an Indian. How bad it is. And you know that our birth rate is too much. So most of our population is children. Almost 60% of our population are children. They are not, they are less than 18 years old. So in that scenario, it becomes even more embarrassing for us that our children are malnourished. Okay. So what all have been described about malnourishment, what all diseases have been described one by one. We will discuss about them, and then we will see what all we can do about them. Okay, so there is one word karshya and also atikarshya that has been described by all the scholars. Okay, Charaka has told atikarshya in Ashtaunindita Adhyaya. He says that shushk sphik udar griva, when they lose all the fat and muscles, so they appear very dry, or they appear very much emaciated. Buttocks, tummy, and back and neck portion. Okay, and dhamani jala santata, there are many dhamanis. There is the child become, the person becomes twagasti shesha. There is only skin and bone, and all veins are visible, and his joints are appear very big because all the muscles and fat has gone. So this is the symptom, these are the symptoms of atikarshya. Okay, karshya has been described by Sushruta. It has been described as a precursor of Shosharoga by Sushruta. Okay, and also Karshyat Pakkatva Mapnuyat. That's what Kashyapa says. So Karshya looks like a primary stage of emaciation where child is not gaining weight and he is very lean and thin. Okay, so you will see many words for this emaciation or wasting in Ayurveda: karshya, atikarshya, shosha, kshaya. So all these are different stages of this one weight loss. Okay, so if we look why this happens, karshya, why this happens in a child's body, so Shruta has given us again. He says ras nimittameva stholyam karshyam cha. Whether child is he is emaciated, he is very thin, or he is very sthula, all depends upon rasa. Good nutrition, more nutrition, less nutrition, again it is all upon the balance. And what happens here? What happens to rasa? That's what Sushruta says, that when the rasa dhatu become, it dries up somehow. It is drying up, then it is not able to supply the nutrition to the body parts or the dhatus. Then karshya happens. Okay, then ati karshya or karshya happens. That's what Charaka says. Now we will analyze the nidana of karshya or ati karshya. I have put both Charaka's and Sushruta's views here. So basically, some of these do not apply to children. Okay, ati vyavai does not apply to them. Maybe Ratri Jagaran also. Some children it might apply, but we will just discuss the things which apply to children. Vatala ahara vihara sevi. Too much Vatalahar Vihar. Again, I told you that Vata because of his Shosha property. Okay. Ati Vyayam. Okay. That might be physical exertion. That might be obsessive compulsive disorders of doing something again and again. That might be a child working in the quarry. That might be a small child going to different houses to do mopping and cleaning. Ati Vyayam doesn't mean that he is doing only exercise. Okay, that this will apply to all the children who are exposed to too much physical exertion. Okay, besides that, Adhyayan obviously Adhyayan will also result into exertion and vata prakopa, and also bhaya, krodha, all these emotional factors are there which again vitiate vata. Ratri jagaran, this is very common among children these days, because since the mobile and Facebook and WhatsApp has happened, now Ratri jagaran has become a very common thing. Okay, so these are the kashai anna, alpa anna, all these are the causes. And here, Charaka, according to Charaka, almost similar clinic nidanas has been given. He has slightly told that ruksha udvatan, snana, and prakriti se hi during the old age, person will become krishya. So that doesn't apply to children. So basically, if you analyze these nidanas, you see that there are three basic causes, or you can put them in three areas. Okay, aharaj nidanas, viharaj nidanas, and manasaja nidanas. I will put lots of stress. Aharaj, you know what all is being done, what all results into malnourishment. Even vihara, we discussed about it, exertion, too much exertion, or it can be anything, physical stress. Okay, manasik causes, our acharyas were very apt in putting manasaja causes also. Shok, krodh, and whenever a child is not happy, emotionally deprived, emotionally abused, you will see that Kashyapa has also given a hint in Fakka. He says anatha klishyate. Okay, so child is orphan, he doesn't have any tender loving care, and nobody is taking care of him. Emotionally deprived children, they are also very much prone to malnourished disorders. And always remember this, because in Ayurveda, when we are treating malnutritional disorders or karshya or undernutrition, lots of emphasis has been given to harsha, or comfort, physical comfort to the child, or mental comfort to the child. Okay, and these days also we see that if child is emotionally deprived, their recovery rate after malnutritional disorders is very poor. Okay, so tender loving care is very important at every time. Okay, so these three types of causes, they are doing nothing, but at the end they are leading to vata vitiation and rasakshaya everywhere, whether it is mental, whether it is physical, whether it is chronic diseases, veg vidarana. In veg vidarana, slightly there might be sroto avarodha also, but ultimately it is resulting into rasakshaya and dhatukshaya. So samprapti of all these nidanas have similar kind of etiopathogenesis. Okay, that is very important. That's how we will deal with all these problems. Okay, so now in clinical practice, when you will be seeing many patients, then you will be receiving two types of mothers. Okay, both have same complaint. One will say, my child is not gaining weight. Okay, and she will tell, oh, he is very active all the time, he is playing, he is eating okay. Or sometimes she would say, no, he is not eating, he just forgets his food, unless I feed him he doesn't even ask for food. Okay, so one set of complaint would be like this. And this child might be constipated, he might be having hard stools, and he might be going to washroom after 3 days, 4 days. His skin might be dry, his hair, lips might be dry. Okay, you will see typical vata symptoms in his body. Otherwise he's happy, but only problem is he's active also. Only problem is he's not gaining weight, his weight might be stagnant for few months or maybe year or two. Okay, so this type of patients you will be seeing a lot. Worried mothers bringing their children to you to ask for some ayurvedic nutritional supplement to their child who is not eating, or in spite of eating he's not gaining weight. Okay, one set would be this. Another set of mothers would be, they would be complaining, my child is all the time sleepy and tired, he's not very active, he's not eating. If I feed him if I feed him forcefully, he would vomit, and often he is having cold, cough, his nose is always running, and he's going to washroom 2-3 times, his stools are too foul smelling, and isko to loose motion hota rehta hai, and he's frequently suffering from loose motions and chest complaints. And the thing is, an allopathic doctor would deal with such child with a nice antibiotic treatment. He would tell, okay, this child is getting infection again and again, and so let's give him a nice antibiotic treatment, and you take care of hygiene and this and that, but still the situation remains same. Okay, so here in this type of complaints, you would see that there are clear features of sroto avrodha and arm formation in child's body. Okay. So in both these sets of patients, your line of treatment should be totally different. Here in first group, you just go switch over to the Santarpan Chikitsa. You increase the Agni, you give Agni Deepana, the Amapachan, Agni Deepana, and then you go for Santarpan Chikitsa, you give Lehana, and you give all nutritious things. Here, if you give Santarpan Chikitsa or Lehana Yoga, then child will not be, he will have more loose motions. You give him some sneha, okay, aapne ashwagandha gata diya, next morning it will come out through his stools, okay, because the srotasas are completely blocked. That is resulting into stuffed nose also and amamala also. So here you have to first do amapachana, Agni Deepana. Later on, once you see the child is better, then you start to increase his weight. Rather, his weight will obviously increase on its own. Okay. So this type of approach should be there while treating Karshya. Next type of, very common condition which is described is Balashosha. Okay. So Balashosha, Atyah Swapan, Shitambu, Shlashmik Stanya Sevena. What happens? These three nidanas has been described. What this is doing? Rasavahi srotasas of the child, they are getting blocked by the kapha, because these three causes are resulting into kapha vriddhi. Okay, so this will result into obstruction of Rasavahi srotasa, and then obviously the child will have all the symptoms like aruchi, pratishyaya, kas, jwara. Like I told the previous slide, I told that this type of patients you will be seeing, though they might not be in Bala Shoshavastha. The symptoms might not be very severe. He might not be emaciated, but he might be underweight or a stagnant weight child. Okay. So ultimately there is gradual emaciation. If this child is not treated, there would be severe dhatukshaya and gradual emaciation. So what is happening here? Nidanas, which are Kafakar nidanas, then they are increasing kapha. Once kapha is increased, Pittamandya, Agnimandya would be there, Ama Nirman would be there. Ama Nirmana is resulting into Srotaso Avrodha. And then there would be Anulomakshaya of all the dhatus, and child will go in Balashosha. Okay. And you see all the symptoms of Amaj Vyadhis are there. Kasa, Jwara, Pratishay, Arochak is there. That okay. So this child is having pallor as well as he is having shosha. Okay, so this is Bala Shosha described by Vagbhata. Another condition which is described by Vagbhata is Parigarbhika. Okay, so in Parigarbhika, what is happening? Matu Kumaro Garbhinya Stanyam Praya Pibannapi. That's what has been told. So this line Praya Pibannapi has been described or deciphered in two ways. Some say that it is Prayo Apibannapi. Some say it is Prayah Pibannapi because of the drinking of Garbhini Mata's milk, or because of the non-drinking of, or Garbhini Mata's milk is not available. So the child is getting Parigarbhika. So what is happening here? There is a mother who is lactating, who is breastfeeding a small child, and then she becomes Garbhini again. She conceives again. So what will happen? Obviously, you know all the hormonal interplay. You know about prolactin hormone, you know about oxytocin hormone, you know about progesterone, estrogen. So what happens? The moment lady will become pregnant again, there would be prolactin levels would go down and progesterone levels will go up. So there would be less and less breast milk. Okay. And there is a possibility of Dushit Stanya also. We don't know, it is not very clearly told, but that's why I have put a question mark here. So this less stanya. Now what is happening? The child, the baby who is breastfeeding, now he is deprived of breast milk. So what all he is happening? There is Mandagni, various diseases, Koshta Vriddhi, and he is going into Parigarbhika. We will SS Parigarbhika again along with the Garbhajapaka. Just now, you just remember that these three clinical features has been told. Mandagni, presence of various diseases, and Koshtavriddhi, and child is going into Parigarbhika. Okay, so various diseases, I mean, Aruchi hai, Vaman hai, Vamana, Chardi, and this there is a depression of the Kayagni also. All these things are there in Parigarbhika. Okay, now comes yoga, which has been described by Kashyapa, only Kashyapa. Okay, so this word itself you will not find anywhere else. You will in Kashyap Samhita you have seen it. So Fakka Dhatu denotes the downwards deterioration or downwards movement. Okay, so fakkati nichair gachati iti fakkaha. Okay, so what is going downwards here? It is the general health of the child. So the cardinal feature of fakkaroga is bal samvatsara pannah padabhyam yona gachati. Okay, so you know that this milestone has been described by in Sharirasthana, that urdhvam pratitishthati samvatsarat. At 1 year of the age, child should start standing. So here what is happening in Fakkaroga, the child has passed 1 year and still he is not able to walk. That is showing his deteriorated physical condition. Okay, so uh, what are the nidanas described by Kashyapa? He says that dushta stanya. What type of stanya? Kafaj dushta stanya, kafa dosh yukta stanya. That is responsible. Pregnant mother. That is for Garbhajapakka, pregnant mother. Chronic diseases. If a child is suffering from several diseases, then also he will have this. Dushta grahani, orphan child. Okay, all this is okay. All this will result into Fakkaroga. Fine. So three types of Fakka he has told: Kshiraja, Vyadhija, and Garbhajapakka. Okay. Now here you see Garbhini Mata, early weaning, Dhatu Kshaya, and Marana. That is happening in Garbhajapakka. Okay. Now, I just told you that Parigarbhika and Garbhajapakka are similar conditions, okay? But if you look at them carefully, you will see that in Parigarbhika, you are seeing all the symptoms of Ama here. There is Kaya Agnisad, there is Agnisad, there is Kasa, there is Tandra, Aruchi, and there is Koshtavriddhi, and then slowly child is going in Karsha, okay? So, and treatment also is told towards removing the Sroto Avrodha and Ama and Kayagni and Jataragni Vardhana, to Yunjat Tatragni Deepanam. On the other hand, what is happening in Kshirajaka, in Garbhajapakka, what is happening? Mother is pregnant again, early weaning has started. There is Kshaya in the body of child, the breastfeeding child. There is Vata Prakopa probably, and Fakka is happening. So you see one nidana is resulting into two different type of pathogenesis here. In one child you are seeing Sroto Avrodh, and in one child you are seeing Kshaya. Okay, so why that is happening? Nidana, Sanakrishna Nidana is only one, early weaning, because mother has become pregnant. So let's look at Viprakrishna Nidana. What weaning food has been given to this child who has been weaned off mother's milk? If he is getting proper food, if he is getting very, what you can say, Abhishandi food or Kafvardhak food, Kafvardhak Ahara, Amavardhak Ahara, बहुत ज़्यादा स्नेह, then in that case, there might be Agnimandya, there might be Sroto Avarod, and ultimately he might go into Parigarbhika, where there is Koshtavriddhi, and where there is Aruchi, Brahma, and Tandra. That is that Tandra indicates the dullness of mind. It is just like a Kwashiorkar, like clinical features are visible here. Koshtavriddhi. Okay. Here what is happening? Maybe the child who has been weaned off, he is not very rich. He is not getting good food. He might be getting some diluted cow's milk. That happens in many families in India. The food is getting divided into many children, okay, again and again mother is becoming pregnant. So if child is not getting any proper food, then there might be vata prakopa, there might be alpa ahara vata prakopa, and he is going into a social-like stage where this is looking like a marasmic stage, okay. Here you will not see, he has not told Koshta is there, Tandra is there. Clinical features are totally different. So maybe it is weaning food which is resulting into either parigarbhika or garbhajafakka in the child. Cause is same, Garbhini Mata. And I would like to draw your attention. Do these conditions present these days also? Yes. If you look at the etymology of Kwashiorkar word, it is from Ghana. There is a Ga language in Ghana. Kwashi Orkar means a child deposed by the a child deposed of mother's milk when his mother becomes pregnant again. Okay, so same clinical features are there here in Parigarbhika also. Fine. In Kshirajafakka, what is happening? Kafajik Kshira dosha, it is resulting into multiple diseases in children, and emaciation is happening, and Kshirajafakka is happening. Kshira dosha, Kafajik Kshira dosha can result into Sroto Avrodha. Now, Vyadijafakka, here orphan child suffering from many diseases such as Grahani, and he ultimately there is akshaya of mans, bala, dyuti, etc., and he fails to walk and crawls on four. So these are the symptoms of Vyadijafakka. Vishirna Hrishta Stabdha Roma. Can you see his hair? You will see all these changes in his hair. Mahoshira, head size is more, chest size is less. Mahodara, there is Koshta Vridhi. Sanshushka, Sphik and Jangha. You can see all the fat and muscles are gone from Jangha and Sphik. And Pramlana Adhokaya, the lower part of the body has become Malin. And Shushka Bahu, the muscles from Bahu are also gone. Here, Pramlana Adhokaya, clearly visible. Kshina Mans and Bala, Mand Cheshta. Child will try to conserve his energy by not doing anything. He would just sit in one place, okay? Here, Malin, Krodhi, Makshika, Krimi, Keet, Gamya, okay? You know that child will be irritable. He's deprived child. So Malin, dirty, and also because of dirt, all these Krimi would be affecting him, okay? Pitaksha, Asthi Pinjara, there would be pallor and he would be very thin. And also because of the Srotaso Avrodh, there is Ati Shingadaka, Ati Mala formation. So nasal secretion and these Nakha formation, the Mahanakha, he would be Mahanakha, growth of the Nakhas would be more than normal, okay, because of the more Khamala formation. Dhatu Poshan is not happening, only Malas are forming, okay. So next we will discuss about Stholya, okay, Stholya. Just look at these data points. Over 38 million children under age of 5 were obese in 2019, okay, very big number. 340 million children and adolescent age 5 to 19 were overweight or obese in 2016, okay. In 1975, 4% children were obese. Now in 2016, 18% of children all over the world are obese, okay. So now what is happening? Children are becoming obese too fast, okay. And don't think that Asia is the hub of undernourished children only. Almost half of the children under 5 who were overweight or obese in 2019 lived in Asia. So this problem of double malnutrition is affecting Asia, India also. You see, everything is going down, but here Stholya has gone up from 2000 to 2019. So childhood obesity is increasing day by day. Okay, and there is a double burden of malnutrition. In same community, you might see some children are overnourished. In same community, you will see some children are undernourished. And also a stool child or a obese child, it's not necessary that he is properly nourished. He might be having other type of deficiencies. Because why this obesity is happening? Children are eating high fat, high sugar, high salt, energy dense, and micronutrient poor food. If you look at Coke, Pepsi, energy dense, too much energy is there, but no nutrition. If you go for cakes, burgers, what all our children eat these days, they are just high energy, low nutrient food. So that is resulting into stholia as well as other type of nutritional deficiencies in those stool children also. Okay, so according to Ayurveda, what is resulting into stholia, what is causing obesity in our children? Ati sampurnad, first cause of obesity. Guru madhur sheet snigdha sevanad. Avyayamat, very common factor. Since the lockdown has happened, children have stopped playing. Already they were not playing, they were playing with mobile phone only. Now it has become worse. Bij dosha, this you cannot avoid, but you can obviously avoid the other environmental factors which are responsible for stholia. Harshanityatvad, a carefree life, and ati medya bhakshanat, too much meat and things which will increase, which has similar properties like meda. Okay, so what happens here in stholia, due to nidan sevana, meda dhatu vriddhi is happening. It is coating all the srotasas, and what is happening? There is blockage in srotasas that is resulting into dhatu kshaya, and only meda dhatu formation is happening. And because of this dhatu kshaya, vata is getting vitiated, and it is going towards the koshtha and doing agni sandhukshana, agni ko stimulate. It is stimulating the agni, which is further increasing the koshtagni. That's why child is indulging in ati bhojana, and all these factors are leading to stholia. Okay, so this is nicely described in Charaka. You can just go through Ashtaunindit Adhyaya again. So this all is happening in stholia. Now I would come to management part. How to manage malnutritional disorders Ayurvedic way. Okay, so we will just see that Ayurvedic approach is very scientific, right from mother and then fetus, then neonate, infant, young child, step by step. At every step, we have to take care of nutrition. Okay, so there are three basic things we have to keep in mind for prophylaxis of malnourishment. First thing is follow the rule. Okay, how many rules are there? We cannot count them. So many rules. Hitashi, matrashi. Okay, that is very important. So matra purna ahar is important for undernutrition, also overnutrition, for prevention of over as well as undernutrition. Hitashi, hita ahar vihar, whatever ahar we are eating, it should have good nutritive value. Okay, achieve sarvarasa satmya. It is very important. Sarvarasa satmya, you will see that when Annaprashana has been described, you will see all rasas are vichitra vyanjan. Kashyapa has told vichitra vyanjan should be prepared, means different type of things should be prepared, although the child is eating for first time. So it is to enable him to taste all the rasa, to enable him to achieve taste for each and every type of rasa. Okay, so all the time sarva rasa satmya is very important, because you know that if you look at Panch Bhautik Sangatan of rasa, then madhur is bhu, tatra bhu jalayor bahulyan madhuro rasa, bhu or jal ka dominance madhur rasa mein hai. It will increase fat. Okay, so if child is eating only madhur, amla and lavana rasa, he will become obviously tend to increase weight. If he is only eating katu tikta kashaya, he will reduce weight. So there should be a balanced diet where all rasas are there. Okay, besides that, dinicharya, ratricharya, ritucharya, vyayam, these are very important. Okay, for body hygiene also and for sthalya as well. Okay, Viruddhahar, there are 18 types of Viruddhahar. We see these days children are indulging into severe type of weird combinations. They should be avoided. Other very important thing is Kshira, Ghrita and Madhu are Satmya to child all the time. Okay, so they should be prominent in the child's ahara. Then take care of nutrition at critical time, Garbhadana, Garbhavastha, soon after the birth for both mother and child. Okay, and at the time of weaning, and also watch what mother is, lactating mother and pregnant mother is eating. Okay, that is also very important. So for prevention of fetal malnutrition, Masanumasik Garbhini Paricharya has been to be followed. There is Kshirapana, Madhur Kshirapana, Ghrata, Navnita. Garbhasthapana Aushadhi Sevan, Garbhasthapana Aushadhis are very important. Okay, Andri, Brahmi, Shatvirya, Sahasravirya. In every form, they should be given to Garbhini. They, as amulets also, as Kshira also, they can be used as Ghrata also. Their Ghrhatapana can be made. Okay, all the time Vrindhan and Santarpan Chikitsa should be given to Garbhini, and avoiding Garbhopaghatakar Bhavas, Vatahar Ahar Vihara and Aushad Sevan should be ensured all the time. We have already discussed it. Okay, so for fetus, what should ensure good fetal nutrition? We have to follow all what all I told already. Vrinhan Ahar, Shali Anna and Masa, Mansarasa, and Am Garbha is very much useful. So Am Garbha, it can be eggs, it can be, they can be given in different forms if mother is a non-vegetarian. Okay, Madhur Shita Ahara, Jivaniya Ghrata, all these should be given to avoid the avoid as well as treat the fetal malnutrition. And in Balak, you know that he is totally dependent upon mother who has just given birth. So Sutika Poshana, if you look at Sutika Poshana, you will notice that the moment Sutika is stabilized, she is given Panchakola Siddha, either Ghrita, Vasa, Majja, any sneha, out of 4 snehas, any sneha in Purna Matra. And once that sneha is digested, she is given Panchakola Yavagu 2 times with Prabhuta Matra of Ghrata. So her portion is for avoiding Vata vitiation. There has been avoid creation because the fetus is now out. So there is Vata vitiation in Sutika's body. So this type of ahara, it avoids, it pacifies the Vata. So that is very important. Sutika Paricharya and Sutika Poshan. Stanya Shodhan according to dosha. So this has been described in very in detail. Stanya Shodhan according to dosha. There you can get many clues. Usually Stanya Shodhan Aushadhi, Patha, Mahoshad hai, Devadaru hai, Trifala, Amalaki, all these are very good for Stanya Shodhana. They should be given to Prasutika. Okay. And Pathya Sevan should be ensured. Panchkarma Chikitsa should be given to Sutika if it is needed. Okay, if you see that Kafadushti is there, then Vamana, Mradu Vamana can be given, Virechana can be given. In child, Jatakarma Sanskara, that is the first feeding of the child, you know. And Matra Stanya, along with Jatkarma Sanskara, Matra Stanyapana, and Samyak replacement of feed in case of deficient lactation. That is very important. You know that Indian households may, it is very common to give cow milk, buffalo milk. That is very, buffalo milk is very abhishandi. And cow milk is also abhishandi. So it will immediately result into Srota Avrodh. So Lagu Panchamula Siddha karke, after treating it with Lagu Panchamula, it should be given. Okay. Lehana should be given. Phalaprashana, it is very important at that time, at the age of 6 months, when the fetal blood is, when the fetal hemoglobin is moving away, it is getting destroyed and adult hemoglobin is being formed. Vitamin C requirements are manifold. And also for the collagen formation in bones, growing baby needs lots of vitamin C. Okay. And mother's milk is a poor source of vitamin C. So Phalaprashana, especially Matulunga hai, Draksha hai, Kharjura hai, all that is very important in children. Annaprashana, as I told you, Chitra Vichitra Anna, different type of Anna. Even meats are not prohibited. There are no taboos in Ayurveda. If the person is a meat eating person, all type of meats can be given. Okay. You will see many mothers coming telling ki we need something extra. So you just find out whether that child is should be given lehana, can be given lehana. You know what are the do's and don'ts of lehana. There shouldn't be any ama or sroto avrodha. Then lehana is not appropriate. You need agni deepana ama pachana. If that is not there, then you give lehana chikitsa to the child. Okay. So for lehana, you know, ashwagandhadi ghrita, shishu shoshna shagrita. These are very commonghritas. We use them. Shatpal ghrita, kalyana ghrita, or brahmi ghrita. Samvardhan ghrita is one of the best lehan yoga. Okay. Panchagavya ghrita, which is Unmada Chikitsa Adhyay, that can be used. So any of these ghrita can be prescribed for the child whose Agni is Tivra, he needs something extra. Okay. When you are approaching a Krish child, a thin child, always find out the cause, whether it is Alpahar, Mandagni, Sroto Avrod. According to that, you treat. Okay. If Alpahar is there, ensure child gets enough ahara. If Agni Mande is there, Agni Deepan Am Pachan Chikitsa should be given. Same with Chirvyadhi. If Chirvyadhi is there, first you treat that Vyadhi and then you go for malnourishment. Okay. So basically, in a nutshell, Krishanam Vranhanartham cha Laghu Santarpanam Chayat. Laghu ahar dena hai, but it should be Santarpan. So Agni and Akash Guna Pradhan Laghu Ahara will stimulate Agni. It would be easy to digest. And Santarpana will nourish all the dhatus. Okay. So Charaka in Sutrasthan 21st and Sushruta in Dosh Dhatu Mal Kshay Vriddhi Vigyani Adhyay, he has told what ahara and vihara can be given. So you will see among aushadhis, you will see that payasya, shugandha, vidari gandha, shatavari, all these are very important. And in chikitsa, sneha basti, snigdha basti, matra basti, all these are very important. And in ahara, kshir, dadhi, ghrita, mansarasa, all these can be used in a Krish child. Okay. So among Panchkarma, Balatel, Kshir Balatel Abhyanga, and Shoshana Shaktel Abhyanga, Chandan Bala Lakshadi Tel Abhyanga, Matra Basti works wonders for the underweight child. Okay, Kshira Bastis can also be tried. Okay, so in his food, in the food of the child, there should be dominance of Kshir, Ghrata, and Vicharana Rupa Sneha can be used. Ghrita can be mixed in his feed, whatever you are cooking for him. Okay. So these are the things which you can give to a Krish child. Okay. And there are variety of preparations told. Rag Shadav hai, Poop hai, Sanyav hai, different manda hai, Peya, all those can be prepared and they can be given for Krisha. These are some Anubhuti yogas for a Krish child. Okay. Prinana Modaka, aap logon ko, you must all be aware of this. Priyala Majja and Madhuyashti, Laja. In same shloka, you would see there are three preparations actually. Bala Bilva Majja se, Dhatki se. So they are Deepan and Sangrahi. According to the diseases you plan, which yoga you want to give. Shevanti Paka has been described by Yoga Ratnakara. Very good. It's similar to it. We use Gulkanda. Okay. Shevanti Paka and Panchasara. Very good. Instead of plain milk and mixing some sweet thing in it, Bonvita or other things which has artificial sugars in it, you just mix honey, you mix ghrita, you make Panchasara and give. Ashwagandha Kshira and Ashwagandha Ghrita. Vidari Kanda Saktuk Churna. It is very good preparation. Here barley and wheat, dry roasted, powdered, along with Vidari Kanda Churna and Chaturjat in them, and along with honey and milk, they can be given. Now, you know that in malnourishment, usually F75 and F100 formula milk is given. What is that? That is also same thing. There is milk in that, milk powder is there, and cereal powder is there, sugar is there. Here we are replacing honey with sugar. Okay, here we are giving Yava and Godhuma. Shrikhand can be given Hankard, and Shunthi Ghrata, Navnita, and Ashtang Manda prepared with Mudgayusha. That is also very, very good. While treating a Krish child or a emaciated child, you have to remember that he cannot tolerate Ati Sohitya. You should not overfeed him. He would vomit or he would have diarrhea. He cannot tolerate sheath. You have to take care of hypothermia. You have to take care of grahani, okay? Because there won't be any absorption. So you have to heal the intestines also, okay? So you have to keep all these complications in your mind while you are treating the child, okay? And it is in nutshell, Balashosh, Parigarbhik and Fakkaroga Chikitsa. I will not elaborate it. You have already studied it. It is nothing but what is written in your books. I think already it's close to one. So I will quickly finish it, okay? So for obesity, Guru or Aptarpana Ahara should be given. So Guru Ahar will satisfy Agni and pacify Vata, and Aptarpan will reduce Meda, okay? So by virtue of their Panchabhutatmic structure, their Guna, their Virya, these Lekhaniya, Chedaniya Dravya, Shleshma Medahar Dravya, Laghu Aptarpan Dravya work upon the obese child, okay? So what all preparations are given among Aushadhis, we can use Shilajatu, Guggulu, Gomutra, Triphala, Loharaj, Rasanjan, very commonly used by Ayurvedic doctors and very good results, okay? And among Ahara, you know, Madhu, Yava, Adki, Mudga, Kulath, and all the millets, Kordu, Shyamak, Uddalak, fox millet hai, ya fir sorghum hai, all these are very good, okay? And very effective. And Vyayama, it's and Panchkarma, it's that also should be used. Now I will briefly discuss two cases, okay? One is it's around 6 months back, we received one 10-year-old child. He lives in Qatar, okay, Middle East. He is a Keralite but lives in Qatar, okay? And the main complaint was excessive weight gain since last 2 years, okay? So patient was always bulky. He was slightly overweight, but after moving to Qatar 2 years back, he put on 30 kgs in 2 years because he was not going out. It is very warm there. All indoor life is there. And also he was eating too much meat there. Okay. So he came to our hospital, and these are his BMI was 40 kg per meter square. Can you believe? Abdominal circumference was this much. And he was having blood pressure also. 10-year-old child had a blood pressure of 130 to 90 by 90 mmHg. So what I did was, in our institute there are Vathar, Kafar and Pithar diets. It's a residential hospital, so patients stay there. So all the time he was given Kafhara diet. I cannot tell you in detail right now, time is not much. And as far as Vihara is concerned, our institute is very big. So if you want to go from one part to another part, you have to walk a lot. If you want to go to mess, you have to walk half a kilometer, then coming back to your room, another half a kilometer. So he was having absolute walking all the time. And yoga practices were started. So pranayam, om meditation, DRT, deep relaxation techniques were taught, and he started practicing them. He stayed with us for 1 month. So I started with Rukshudvartan with Kolakulattadi Churna plus Triphala Churna. It was given for 7 days. And oral medication for Amapachan, I just gave Chitrakadi Vati, 1 tablet after meals for 5 days. After that, I just gave him Amalaki Churna, 3 grams, 2 times a day with lukewarm water. And Navakagugulu, 1 tablet. Very simple treatment, no fancy treatment. But we attacked him through Ahara Vihara and Aushadhi. And within 1 month, He lost 8.5 kg weight, abdominal circumference was reduced, and his blood pressure came back to normal because of the pranayama or meditation. I didn't give him any antihypertensive drug. Okay, so this was one case. Another case is worth mentioning. This was not actually a case, it was just a person whom a lady I met when I visited my home. So she was having she had a baby of 8 month age, and typically the baby was not gaining weight and he was having excessive drooling and gurgur sound was there in his throat. Okay, so I met that lady in a marriage and she told me about all this, and all the time she was changing the bibs of the baby. Otherwise baby was very nice, he was alert, happy, doing cuckoo, kaka, all type of sounds he was making, trying to talk, and dentition has not started. So now at this age, 8 months of age, if a child is having excessive drooling suddenly, then you have, first thing is, okay, he is teething is happening, that's why he is drooling. Or you can suspect CP or autism or respiratory tract infection. But I went, since I didn't suspect any of these, and I thought, okay, even if teething is happening, what is the harm in doing one stanya shodhana for mother? Okay, so I suspected, I on the line of Kafaj stanya dushti, I just told that mother to take Chitrakali Vati and Ajmodadi Churna initially, and followed by just one kashayam, which I prepared for whatever was easily available for that lady. In Uttarakhand, vacha is very abundant, everywhere it is found. And along with that, dashmula, shunthi, nimbapatra, and trifala. This kashaya was given to that mother, okay? And just for baby's sake, I told her to put amlaki churna and madhu, rub it in the gums of baby, okay? So after few weeks, she called me. I came back to Bangalore, and she told that baby has started gaining weight, and his drooling has also reduced. So kafaja kshira dushti was there probably, and that stanya shodhana helped this child. Okay, now at this time that child is almost 4 years old and absolutely normal child. Okay, I will quickly. I'm sorry, it is 1 o'clock. Ma'am, can I continue just 5 more minutes maybe?
Yes, madam, you can continue.
Yeah, okay. So I will just quickly discuss malnutritional disorders at present and scope of Ayurveda in their management. Okay. So you see, these days we are not, we are just seeing malnutritional disorders as stunting, wasting, and as obesity or underweight children. Okay. So stunting is very common. India has 46.6 million stunted children, a third of world's total. That is very bad. Wasting is very common among 14 million children are wasted right now all over the world. And overweight children, 5.6% of all the children underweight all over the world were overweight in 2019. Okay. So these are very bad data. So we have to, what we can do for these children. So these are, you already know these anthropometric measures. Actually, underweight is a child whose weight is low for age. Okay, and wasting is low weight for height. Okay, and stunting is low height for age. So these days, WHO doesn't recognize PEM, protein energy malnutrition. It is just a syndrome. Okay, Kwashiorkor marasmus, they are just syndromes. Actually, the malnutritional disorders should be classified like stunting, wasting. Okay. So these are the definitions of the stunting, wasting, and in children under 5, parameters are different. Over 5, parameters are different. So when a child is wasted, if he has less weight for his age, so usually it indicates that there is severe recent malnutrition, recent weight loss. Okay, either child was sick or the food has become less. Okay, and stunting is a result of chronic malnourishment, you have to remember. And you have also noticed that Ayurveda has not described much about stunting. in malnutritional disorders. Only wasting is described. All the malnutritional disorders in Ayurveda are wasting actually. There is wasting. Karsha is there, Shosha is there. But in Ashtaunindit Adhyay, Ati Hraswa, one Nindit Astrait is given by Charaka. And also, Vamanatva is a trait of Vata that has been Vatananatma Vyadhi, it has been indicated. But as a malnutritional symptom, it has not been described. Okay. Now we will look at the condition of our country. See, here we are in prevalence of wasting. You see which countries, even Pakistan is better than us, even Afghanistan is better than us, Bangladesh and Nepal are better than us. We are with Sudan and we are with Yemen. We are the worst affected country. Very bad condition in India. Similarly, here you see stunting. We are again in the pink zone along with whole whole Africa as well as South Asian countries. Okay, so at every front we are doing bad. Every front. Only the obesity is not very high. It is very low in India, childhood obesity. But in urban areas, you will see obesity is becoming very common. Okay, so on April 2016, United Nations has declared 2016 to 25 as Decade of Action on Nutrition. Okay, so for obesity, they have made a 6-point program to avoid childhood obesity. So we would see what we can do in this 6-point program, where we stand. First point is promote intake of healthy food. Obviously, Ayurvedic scope of Ayurveda is enormous here. If we strictly follow the dietetic recommendations by acharyas, promote physical activity, yoga, pranayam, vyayam, all this enormous scope. Preconception and pregnancy care, Garbhini Paricharya, that will help in that. Early childhood diet and physical activity, so that there is Jata Karma, Phalaprashana, Annaprashana, Matrastanya, and Lehana Yoga, Vyayam, Pranayam, all can be applied there. And then comes health, nutrition, and physical activity for school-going children. So again, strict following of dietetic recommendations and yoga, pranayam, vyayama. Weight management can be done by using all of this. Along with that, Lekhan, Aptarpan, Medohar, Aushadhi, Shodhan, Chikitsa. So in managing obesity, Ayurveda has enormous scope. But in case of severe malnutrition, I would not claim too much, especially in the initial stage of severe malnutrition, when we have to treat very life-threatening complications like hypoglycemia, hypothermia, infections, dehydration, shock. We have rather nothing which can help them. We need lots of research if we want to help in this area. Okay, in rehabilitative stage, when the child starts feeding and we try to recover the lost weight, probably yes. At that time, we can see that Deepan, Pachan, Laghu Santarpan, and also training mother, teaching her all the Ayurvedic concepts of dietetics would help. In follow-up, catching up growth and prevention of recurrence, definitely yes, Ayurveda has enormous scope. So Ahara Vidhi Palana and Santarpan Ahara, Rasayan Chikitsa all have enormous scope in preventing this and in follow-up. So this much we can do. And ultimate aim is this one. Samamans pramanastu samsanhano naraha dridendriyo vikaranam nabalena vibhuyate. Okay, so this should be our aim. And I would request our new generation to go into research and find out, like I told you about Vidari Kandadi Churna, you can compare it with F75 and F100 and see how much Vidari Kandadi Churna Yoga can be sufficient to provide 75 kilocalories or 100 kilocalories. So there is enormous scope for research in future. Okay, so thank you all of you for listening patiently. That's all from my side.
Thank you, madam. Thank you for a wonderful presentation, madam. So now
Thank
I
you.
request the participants If you have any queries, you can put them in a chat box, or otherwise you can unmute yourself and ask the queries directly. Okay. Meanwhile, there is one question, madam.
Yes.
So you asked to use madhu instead of sugar in malnourished children. It is a lekhana? Will it be helpful in undernourished children?
Very good question. Very good question. Madhu is lekhana also, but madhu has property to go inside the srotasas. Okay. So madhu has dual property like gugulu. Naveen madhu is vranhana. It is always a rasayan. It is rasayan. It is vranhan also. If you are using it for obesity, thalya, you go for old madhu, purana madhu. Okay. And if you are using it for undernourishment, you use naveen madhu. Madhu is, there are three things, always remember in your clinical practice also: madhu, yava, and godhum. These three things are there which you can use in undernourishment as well as overnourishment. They have different properties. Okay. So lekhan madhu, puran madhu would be lekhan. It is vranhan also. And madhur rasa is always good. And I will tell you, madhu contains zinc. Madhu contains B2, B3, B9, that is folic acid, and all range of vitamin B, except for vitamin B1 and B12. Okay. It contains magnesium. It contains simple sugars, and it is janma satmya to child. Janma satmya means mother is also having madhu in his garbhini paricharya, and the moment child is born, we give him madhu. So it is always satmya. Okay. So it can be given in both conditions. It can be given.
Okay, madam. But madhu is said to use in a purana avastha only, according to Ayurveda, as nava madhu may induce allergic reactions in the children. So how far it will be safe to use nava madhu?
Nava madhu means instantly taken out madhu nahi. I mean, we can keep it in the shelf for a while. Puran madhu can be 10 years Puran madhu, 100 years Puran madhu. And these days, whatever madhu is there, we don't know what type of madhu is that, actually, frankly speaking, whether that is madhu also or not. So we have to make sure when we are dealing with the patients at that time, we have to tell them that they have to go for madhu. Naveen madhu, I don't mean that you immediately take it out and eat it. Okay.
Okay.
Yeah.
Okay, madam. Another question, madam. In Kshiranada and Annada group of children, so what is the right time to give Kshira, means milk, as a supplementary?
Supplementary milk. Okay. We have seen that the sooner we start giving top milk means
No, I didn't mean top milk, madam. I mean in another age group of children. So usually we give Kshira, but we usually give it in the morning hours. But morning is Tafakara. So in that time, so what is the right time to give Kshira, I am asking.
Okay. Time you are saying, see, on the basis of the children we deal, children usually in morning, if you feed them milk, then what will happen? They will have nausea. They might vomit it out also. Actually, Kshirapana is indicated at night. It induces good sleep. Okay. So it is upon the convenience of the parent and the child also when to give. I don't think that there should be any hard and fast rule that it should be taken at this time only, but I would suggest at night before going to bed, Kshira can be given.
Okay. Okay, madam. Thank you, madam. So just before concluding, I would like to present a vote of thanks. I'm very much thankful to the management and board members of SVM VV Sangha Ilkal for the support in conducting all these webinars. And I would also like to thank Dr. Champa Pant madam for delivering a wonderful lecturer. And we are all, on behalf of myself and the principal and staff, we are grateful to madam for taking a lot of efforts in sharing her knowledge and experience with us. And I would also like to thank our principal, Dr. K.C. Das sir, for his constant support and encouragement in conducting this webinar. And also I would like to thank Dr. V.P. Hiremet sir and Dr. Krishna Jillur sir organizers of KumarabBharana 2020, a national webinar series on Kumarabharana. And also I would like to thank all my colleagues for their timely help in conducting these webinars. And also I would like to thank all the participants who have joined us today through the Zoom meeting, and also who are those who are watching live at a YouTube. Thank you one and all. Thank you, madam.
Thank you all. Thank you.
Shall I close the session, madam?
Thank you.
Thank you.